Um, Now, this may happen as you're answering the question. So your patient, you did a lot of things, right? You got orders for furosemide and you did some interventions to your patient. The patient is not going to remain the same. I mean, you don't want them to remain the same. You want them to progress and change over time, right? So in between the case study, they may provide an updated information on the patient. Be very specific as to what kind of changes, because the changes could be good, the changes could be bad. So pay attention to, did your patient progress in the right direction, right? So we're going to read through the updated scenario. So let's say maybe change of shift happened and the previous nurse is giving you an updated scenario, right? So Mr. Dawson diagnosed with acute pulmonary edema. The physician ordered Lasix to be administered and to continue monitoring the patient. 2 hours later, 2 hours after you gave furosemide, the patient's respiratory status is improving and he's urinating frequently. I mean, that's what we wanted, right? Great job. The patient is showing some progress. Now, as an oncoming nurse, you got that report. You're feeling good. Okay, the patient is breathing better, So you're looking at your updated information from the electronic health record. Your temperature, 98, and he was having a low-grade fever of 99.2, so it is getting better. Heart rate is 112, looks like it's going down. Respirations going down. Blood pressure is looking better. Saturation is looking better. He's on BiPAP. You gave furosemide and he's getting it every 6 hours. Normal saline at 75 mL an hour. Solimedrol 125. Lab results shows potassium of 3.1 and magnesium of 2.1, white cells 8. And so those are all some of the details that you are reading there, and you're still giving oxygen and you're still monitoring for their intake and output. So just peruse through all that details that you got through the electronic health record, because keep in mind, the next question will be about this updated status of the patient. Okay, so I hope you got a moment to read through all those. Now, the next question will be asking about what are the 2 information in the slide that concerns you. Okay, I hope you got that question. Which of these findings in this slide concerns you the most? So let's move on to question number 6.
All right. We have low potassium.
Okay.
Concerned hypocalcemia.
Okay.
Potassium.
All
Potassium is low. Blood pressure. Potassium is low. All right. We have potassium and magnesium. Potassium low. BP, K level, hypokalemia.
Excellent, excellent. So everyone agrees that potassium is low, right? But I did not get what I was looking for. Probably that assessment finding kind of threw you off. So which of the following, results or orders that you saw concerns you was the question. So everybody got that potassium correct, right? 3.1. The patient is on furosemide, which means that his potassium will keep dropping. But there was another thing that was concerning. So in that drop down, you have 3 things. You have the heart rate, you have the urinating frequently, and normal saline at 75. Out of these 3, which order concerns you, or which finding concerns you? So I'm still waiting for one more answer.
HR is high. That's what we got.
Okay. Anyone else?
NS 75.
All right.
HR and urinating frequently. Dehydration, heart rate.
All right. So we are getting a variety of answers here.
We are.
I know. So the question was, which of the following needs immediate follow-up, right? What concerns you the most out of these 3? Now, if I were a nurse and the patient's heart rate was 135 before and now it's 112, am I getting immediately concerned? No, because it's going in the right direction, right? It's slowing down, which means that my heart does not have to compensate as fast. So, you have to think about it as your patient, not a different patient. It's the same patient whom we started with a heart rate of 135. Now his heart rate is 112. I'm feeling better about it, right? Urinating frequently. I gave furosemide to this poor guy. He is going to urinate frequently, and that's the intent, right? So it's a good thing. But I am concerned about that order for normal sodium 75. Why is that? Well, this patient is on fluid overload, pulmonary congestion, pulmonary edema. I should not be loading this patient with more fluid. So that's my biggest worry about the order. So I hope it makes sense. So that is something that requires immediate follow-up. The next one, all of you got it right, potassium, right? Pretty straightforward, 3.1. That needs to be addressed because the patient is getting furosemide, okay? So keep in mind, you're talking about the same patient. So I hope it made sense. The heart rate, while it's elevated, while it's concerning, it's better than where we started, right? So you have to look at that trend of going in the right direction. All right, here we go. The last question, pretty straightforward question. It's asking you, the patient starts to decompensate again, develops worsening pulmonary edema. Somebody forgot to give them the furosemide. The physician decided that the patient requires emergency intubation. Remember, he was on BiPAP. Maybe that's not helping him. Now we really need to intubate the patient and give him some mechanical ventilation and oxygen. Which of the following is a priority nursing diagnosis for this patient? Is it ineffective breathing pattern? Is it risk of infection, decreased activity tolerance, and risk for electrolyte imbalance? In the given question, which of the following nursing diagnoses take priority?
So far, we've gotten number 1.
Excellent, excellent. Any other answers?
Still number 1. Looks like that's the consensus.
All right, that's awesome. And we do apply strategies, right? Don't forget about your strategies. It's pretty straightforward strategies that you can apply here because 2 of them are risk, right? Your potential problems can wait. You got to deal with the active problems, right? So 2 of them are potential problems that you could eliminate. Risk for infection, risk for electrolyte imbalance. They are potential problems, could happen, not a problem right now, eliminate. So you have easily eliminated 2 and you are left with breathing pattern and decreased activity tolerance. Out of those 2, given the scenario, you can apply another strategy, ABC, right? Airway, breathing, circulation. Airway always takes priority. Ineffective breathing pattern is your right answer. Great job. So, I hope this presentation was somewhat helpful. It was a pretty simple, straightforward scenario on the next generation NCLEX style of questions, like the matrix question, the bow tie question, the highlighting question are all like different style of questions. But you can see that it's very straightforward because in the current NCLEX, all 75 or all 145 questions are about different patients, right? So each time you have to think differently. Okay, now I'm dealing with pulmonary edema. Now I'm dealing with MI. Now I'm dealing with a patient with stroke, right? You got to change constantly your thought process. Whereas the case studies, those questions are kind of like a story, right? They're all linked to each other and they are all telling a story about a patient who's either getting better or deteriorating, and what do you do, right? So I think it's kind of like a detective work trying to find out, just like you are doing in your clinical practice, is my patient improving? No, what should I do next, right, to prevent a complication? I have so much fun, looking into next generation NCLEX question. I hope you do too. But guess what? If you're struggling, that's what me and my team are here for. We prepare you for NCLEX. We prepare you for next generation. Our question clinics these days are loaded with next generation questions. So if you don't have the habit of attending question clinics, please do so, because your instructors will walk through these different style of questions, how to answer them, and what strategies you can apply. Because as nurses, we are experts in taking care of our patients, in clinical judgment, but that's not quite enough to pass NCLEX. Okay, you are an excellent nurse, right? That's why you excelled in everything, and you're trying to like accomplish this next checkbox in your life too, right? Pass NCLEX and come and work in US, which is amazing. But that's not just enough to pass NCLEX. You gotta know the strategies. Our instructors does an amazing job through the webinars, through question clinics and open forums. They answer your question, they help you and guide you through this process. So I really hope you join our team and enjoy our NCLEX program. I never say that it's easy. Okay, I've been there, done that. I'm an international nurse myself, and I know that it's not an easy task to be taking care of your family, going through a lot of financial, personal, and other stress, work full time. And I know that some of you work full time, 12-hour shifts, 5 days a week. So you don't have a lot of time for yourself or your family. I know that it's not easy. Our team knows it's not easy, but if anyone can do it, it's you, because you have the resilience, you have that stamina to do it. So I do appreciate all your hard work. Our team is here to help you. So please don't hesitate to reach out to us. We are eager. We get excited when our students reach us out to us and say, I need help. I need your coaching. We love that kind of emails. We get really sad when we don't hear from them. Okay. So we are here to help you. Please reach out. And if you are still thinking about joining Avant Healthcare Professionals or thinking about NCLEX and Next Gen, know that we are prepared to help you. Okay, we have the resources and we are prepared to help you. So I hope you consider joining our team, and I can't wait to meet you all in person. So thank you so much for joining us today.
Yes, it was great. Thank you, everyone. And on the comments, there's a link. If you haven't applied to Avant, apply today, and you'll get excellent support from Ansu and her team. So have a great day, evening, wherever you are in the world. Bye.